In this evening's Health Alert, health experts want parents to know that colic or constant crying does not mean bad parenting.
CBS 19's Melissa Daigle shows us more about this difficult baby phase and new ways that parents can better understand colic.
What's wrong? You're fine.
Cruz Jordan is about to be 2 years old. This time he's just crying because he wants his sippy cup.
What do you think? You want this?
A quick fix to end the tears. But his mother Cara remembers when he was 2 months old and the crying would sometimes last for hours for no apparent reason.
I just didn't know how to fix it.
As a first-time mom, she says that was terribly frustrating.
Very much so. Lots of rocking, lots of singing, lots of consoling and hugging. It was a little difficult.
Trinity Clinic pediatric nurse practitioner Catherine Giordano says the Jordan family isn't alone. In fact, she says most babies will get colic.
Usually what will happen is a parent brings a baby home from the hospital. They're fine. They don't seem to cry a whole lot for the first few weeks, and then boom, somewhere between 2 and 4 weeks, the crying starts to happen a lot more frequently.
And she says that's completely normal. Those with the National Center on Shaken Baby Syndrome want parents to think about colic as the purple period of crying, with purple being an acronym for important information on crying. For example, the L stands for long-lasting, meaning crying can go on for 5 hours per day or more.
I think the guidelines can be helpful for parents just to reassure them that, hey, look, this is a normal thing that happens to children. And so it gives them sort of an acronym to remember what is the normal, what can they expect from their child.
Giordano says the peak crying period is 6 weeks old. As babies mature and their brains develop, she says they'll eventually grow out of their fussy periods.
Can you say hi?
Hi. Cruz did, and his mom says today he's a much happier and enjoyable child. In Tyler, Melissa Daigle, KYTX, CBS 19 News.
Very cute there. The nurse practitioner says that crying is usually classified as colic when there's a pattern. For example, most babies cry at the same time of the day, usually in the afternoons and evenings. It's time to make an appointment with your doctor if your baby's crying is getting in the way of feeding and sleeping, or if they're sick.